Australian Dental Association released a dental health plan in February, and they're hoping the government will take up their recommendations. Australia's oral health isn't looking good. There are too many groups falling through the cracks of our public dental health system. Here are some stats. Brace yourself. Approximately 3 in 10 adults have untreated tooth decay, and low-income households have a higher rate of toothache, tooth decay, periodontal disease and missing teeth. Aboriginal and Torres Strait Islanders are 150% more likely to be hospitalised for preventable dental problems. 37.6% of Australians from non-metropolitan areas have untreated tooth decay, and that's compared to 23.5% of people in the major cities. More than half of Australians aged over 65 have periodontitis or gum disease, and shockingly, over 20% of the aged have complete tooth loss. When it comes to our youngsters, they're not faring much better. More than half of all 6-year-olds experience tooth decay in their baby teeth, and nearly half of all 12-year-olds have tooth decay. Why is this? Why is our nation's oral health so poor? With oral health, there's usually a combination of factors involved. Things like high sugar diets, smoking, excessive alcohol and poor oral hygiene, not to mention difficulties getting an appointment in our public clinics, limited clinical options once they're there, and limited funding. Something needs to change, and that's why the Australian Dental Association has created a dental health plan, which it hopes will be adopted by government. Currently, we have 3 public dental health schemes here in Australia. The Department of Veterans Affairs Scheme, the Cleft Lip and Palate Scheme, and the Child Dental Benefits Scheme, which unfortunately is currently under threat and may be axed altogether. The Australian Dental Association proposes that we retain the Department of Veterans Affairs Scheme and the Cleft Lip and Palate Scheme, and that some changes are made to improve the Child Dental Benefits Scheme. And it would like to see 2 new schemes introduced, the Pensioner Elderly Dental Benefit Schedule and the Adult Dental Benefit Schedule. The last 3 on this list address big gaps in the current system. They'll improve on current monetary limits and allow a wider range of clinical services to be covered rather than the limited treatment options that are available now. The plan identifies particular disadvantaged groups and recommends that these get extra funding, additional to the yearly monetary limits that other patients have. These groups include people living in remote areas, those of Aboriginal and Torres Strait Islander descent, and those with special needs. Alongside these 5 public dental health schemes, the Australian Dental Association want to see 4 countrywide initiatives implemented. Initiative 1 is to have more widespread fluoridation of our water supplies. Fluoride is a mineral that has been proven to strengthen enamel and prevent tooth decay, and it's been added to many metropolitan water supplies throughout Australia as a public health measure to reduce dental cavities. The National Dental Health Plan recommends fluoridation of the water supplies in all areas of Australia that have a population of over 1,000 people. In areas with a lower population, the ADA suggests that they should have additional financial support to access topical fluoride protection programs. Initiative 2 is all about tobacco control. Dental care professionals have long been concerned about the use of tobacco in any form because it's a risk factor for oral cancer, periodontal disease, tooth loss and staining. Under the proposed dental health plan, practitioners in private dental practices would provide education about the oral health implications of smoking and would provide support to quit. And they would support public awareness campaigns about smoking and the use of other forms of tobacco, like chewing tobacco. Initiative 3 is all about dietary and sugar control. Now, the dental profession has always encouraged Australians to reduce the amount of sugars they consume because of its well-known ability to cause tooth decay and therefore poor oral health. Under the proposed dental health plan, dental professionals will promote tooth-friendly choices of foods and beverages. And Initiative 4 involves promoting the awareness of the importance of good oral health. This would involve making people aware that good oral health is important for general health. The Australian Dental Association's vision will improve oral health care in Australia and make it more accessible to all Australians. The involvement of both public and private dental practices in delivering dental services under the 5 schedules will increase the availability of dental care and the ability of all Australians to access that dental care. The 4 accompanying recommended initiatives will ensure that more Australians have access to fluoride and information and assistance in preventing dental diseases and improving their general health. We support the plan and we hope that the government will adopt it. It will reduce costs in the long run and improve the quality of life for all Australians.